So let me just take a minute to explain auditory processing disorder. There are many pathways to this as a problem. I'm going to explain just one. It's one that I see commonly in my practice. When I'm meeting with parents, I always ask about the child's development. Excuse me. In particular, one of the things I'm curious about is, has this child had earaches, particularly between the ages of 1 and 3? And why that's important is because that is when the use of language and the understanding and the expression of language is developing in the brain. So here's what happens. You have these recurring ear infections, and it's as if you're listening to the world with your head underwater. Try this for a second. Cover both ears with your, I can't do that, I'm holding the phone, but cover both your ears and count out loud to 5. 1, 2, 3, and you have to do this with both ears covered. 1, 2, 3, 4, 5. You notice that the sound that you hear, it's different. It's as if it's surrounding your head. That's what the world sounds like to a kid who has ear infections. Their ears are blocked. It's like their head is underwater. And if between the ages, of typically 1 to 3, this is what's going on, that is when their brain is wiring itself to understand language. The kid gets older, maybe they've had tubes in ears, maybe they've had antibiotics, but the kid gets older. Eustachian, I can't say that word. The tubes in the ears get bigger with age, just like our nostril. The nostril of mine is bigger than the nostril of an infant. It gets bigger. So the fluid drains, and now the kid hears normally. However, the brain has been wired to hearing as if it's underwater. That's a problem. When you did that 1, 2, 3, 4, 5 with your hands over the ears, you notice it's kind of hard to tell where the sound is coming from. Place this kid in the classroom, and when they hear things, they may not know where that sound is coming from. Also, it makes it more difficult to filter out the sounds we shouldn't be listening to. So kids are in their seat, one's yelling this, one yelling that, they're talking this way, and the teacher says, take out your books. The problem is that child wasn't able to filter out all the other sounds to concentrate on the teacher's instruction. Now it looks like this kid is willfully not listening when they are. So this is just one pathway to auditory processing disorder. To get it diagnosed, you go to an audiologist with specific training. Normally, when you see an audiologist for a hearing test, you hear the beeps and the boops, different volumes, different levels of frequency. So do you hear this? Do you hear that? Beep, 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 beep. Different frequencies. Beep, 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 beep. Different volumes. When you go for an auditory processing assessment, you may hear one sentence in one ear and noise in the other. Were you able to figure out what you heard from this ear with the noise in that ear? Or you may hear two very different sentences. Can you figure out what you've heard? So the test looks very similar. You're going to have a child likely in a soundproof booth or with headphones on, and they're going to be listening to things, and they're going to be telling the assessor what it is they're hearing. But they're listening to different things now for the auditory processing disorder test. Okay? So I just wanted to provide this quick video as a basic bit of information tool for parents. Now, if your child had those ear infections, it doesn't mean that they will develop this disorder, but it does mean that they're at risk for it. So if your child surfaces with problems at school and somebody's telling you that they think it's attention deficit hyperactivity disorder, but you know of your kid's history with ear infections, get that checked out as well. I'm Gary Derenfeld. I'm no audiologist or speech language pathologist,
But this is some of the information that I've learned over the years helping parents of kids. Go to my website, yoursocialworker.com. Bye now.